Thank you, Louise, for that introduction. So thank you for having me to talk about STIs, which aren't really talked about a lot at INSU. So this is a collaboration that actually started at INSU in Scotland, a chat that Nadine and I had. So hopefully people started some collaborations last night. Anyway, I'll get going. Sorry, I'd like to acknowledge Gabrielle, who's the lead author on this, who couldn't be here. I'm presenting on her behalf. I'd also like to acknowledge the First Nations and Indigenous peoples of both Australia, where I'm from, and Canada, where I currently live, and in particular context acknowledge that the legacy of colonialism and ongoing racial injustice, which sees Indigenous and First Nations people both over-incarcerated and overrepresented in STI data. So STIs are on the rise. Why do we care about this at INSU? Well, basically because there's a rapidly growing body of evidence suggesting this is linked to substance use and incarceration. And as we all know, people who use drugs are well and truly over-incarcerated. It's also really important to consider that there's lots of other key populations that intersect with people who use drugs. So Indigenous, First Nations, Black and Brown people, sex workers, sexual and gender minority groups. And these groups, even if they don't use drugs, are actually also, in particular, hard sex workers, and in some countries, gay and bisexual men are over-incarcerated. So pretty simple methods. I'm not going to read this all, just the bottom points there. We stratified this by adults and adolescents, and also stratified it by sex, so male and female when we're talking about sex in here. So 195 articles we had in our review, the vast majority from high and middle income countries. The majority were males, probably showing the males are generally overrepresented, but importantly females were in there a lot as well, which I might come back to if I have time. So chlamydia, 6.5% prevalence among adult females, a fair bit lower among adult males. Adolescent females considerably higher than even adult females, and likewise adolescent males at 7.4% considerably higher than among the adult males. Gonorrhea a bit less, females higher again in both cases, but again also higher among adolescents. Syphilis, which is my new area of research, you see the flip around, so 6.2% prevalence among adult females, 3.3% among adult males, and very similar actually among both adolescent females and males. So what do we take from this? So there's been a lot of articles showing this link between substance use and incarceration. So these conclusions are essentially we should be testing for STIs among people who are incarcerated. The question remains at the time of incarceration, as many of us know from our work, this is a hectic time and might not be the best time, so we need to think about models of care. We all know hepatitis C is being scaled up in prisons, but not in all cases, but clearly where this is being scaled up, we probably should be integrating STI testing with these services. I didn't put this in the results, but a problem with this is there is extremely high heterogeneity in these results, so 90% plus of people who don't know about systematic reviews. That means essentially the results are all over the place. So if we're going to do STI testing in prisons, or other incarcerated settings, should this be driven by the local epidemiology? But the problem with this is that funding for sexual health care in general is stagnant or actually declining, adjusted for inflation in a lot of countries. So, we don't actually know necessarily what the true local epidemiology is, and particularly among more marginalised groups that historically haven't been prioritised in the STI responses, such as people who use drugs. Bacterial STIs specifically. As someone who's moved to the other side of the world to do a program of research on STIs among people who use drugs, people who are incarcerated, clearly there's more research needed, otherwise I won't have a very successful postdoc. So I think there's some fundamental questions. We need the input from people who have lived and living, both live and living experience of incarceration I think that's very much missing from the research. Thank you very much. You can send all the hard and difficult review questions to Gabrielle, but I would love to talk to people about sex, sexual health and STIs among the populations at INSU and get some work happening and collaborations happening. So if you're working in this space, love to hear from you. Thank you very much.
Thank you.